Agenda item is a community mental health services update regarding state funding changes, and I'm going to, before we have the speaker, I'm going to seek a motion to receive and file. Moved by Duge, supported by Drillette. Hi. Our Executive Director of Community Mental Health, Mr. Kinch.
Good afternoon, Madam Chair. Thank you for the opportunity to present to the board. I am John Kinch. I'm the Executive Director for Macomb County Community Mental Health. Presenting to you today in 15 minutes that I'm allotted for two purposes. One is that I'm in the midst of a funding crisis, and I'm looking for the opportunity for perhaps the board to support me in some resolution to resolve of that funding crisis. And then secondarily, too, as a courtesy to the board relative to the new board members who are here, I'd like to know a little bit about community mental health, as well as the old board members, not old, but those of you guys have been around a while, a refresher. So if you look at the legal mandates, I'm going to run through these slides pretty quickly because I really need to get to the funding piece in my allotted time. If you look at the legal mandates, is someone going to push the slides along for me? Are you going to do that?
You just want to hit the space bar.
I have to do that? There you go, thank you. The legal mandates, the Michigan Constitution really speaks to the fact that physically and mentally ill and seriously disabled people shall always be fostered and supported. So it's the Michigan Constitution. And then also the Michigan Mental Health Code says wherever there's a local capacity to be able to deliver those services, we're going to do so and not do it in an institution. It's been like that for 40, 50 years here in Macomb County. The Michigan Mental Health Code really speaks to the essence of person-centered planning, a very wholesome process and activity that you go through to be able to address one's treatment needs. Our service system is set up through a community mental health services program, a CMHSP, and also a prepaid inpatient health plan. We are not a small mom and pop shop. People often think community mental health programs is a small group home. Not the case. There are 46 community mental health service programs in the state of Michigan. Out of the 83 counties, there are 10 prepaid inpatient health plans. A community mental health services program, to that next slide, is what we deliver in the way of services. Of those 46 community mental health services programs, we deliver services. And I'll explain that a little bit more later. The prepaid inpatient health plan is the managed care entity. They're the folks that hold all of the monies. In other words, they're like an HMO in some respects. So there's the 46 CMHSPs, the 10 PIHPs. The map, if you look at that map, it's indicative of the 46 community mental health services programs. If there's not a bold line around a county, then it's a standalone community mental health services programs like Detroit, Wayne, and Macomb. We're all standalone community mental health services program. You look right in the center of the state, that triangulated Clinton, Eaton, Ingham around Lansing. CEI, Clinton, Eaton, Ingham, is the community mental health services program. So there's 46 in the state, and then there's 10, and they're geographically by border there. If they're in a border, then they're collectively a CMHSP. There are 10 PIHPs, the folks that have all the money. And you look at Macomb, Oakland, and Wayne, we are standalone prepaid inpatient health plans. We're the only three standalone prepaid inpatient health plans in the state of Michigan. The rest of them are all combined together. Don't be deceived by the size of Macomb. It's not the geographic location, it's the density of the population and the density of the enrollment of consumers. Macomb is larger than the Upper Peninsula and Northern Michigan combined. So just so you have that understanding. That's why we got that designation as a standalone PIHP. In Macomb County, when you talk about who we're servicing, roughly 130,000 covered lives, consumers who are Medicaid, with some general fund consumers. My Health Link demonstration, we're heavily engaged in a demonstration with the federal government. Medicare, Medicaid is a My Health Link demonstration. Healthy Michigan plan, the expansion is in there. So all of those consumers, and you're hearing about the Michigan Healthy Michigan plan and expansion, 60,000 covered lives. So out of your total population of 800 and some thousand people in Macomb County, about 180,000 of those consumers are Medicaid eligible. And if they need our services, we have a responsibility to serve. We service the most difficult, challenging consumers that are there. We service people with long-term thought disorders, long-term affective disorders, those who have major depression, not somebody with a who lost their job and have some dysthymia or small limited depression, long-term depression, schizophrenia, bipolar condition, children with serious emotional disturbance, developmental disability, disabled children with autism, epilepsy, and long-term substance abuse consumers as well too. We deal with the most difficult, the most challenging, the most vulnerable mentally ill consumers in the state. In Macomb County. When you look at the next line there, I got behind there a little bit. Look at the next line. These are just some of the Medicaid covered services. I'm not going to go through them. They're pretty extensive. They're all federal entitlements. We have the responsibility to deliver those services if they're medically necessary. Go to the next page, and there's a continuation, but it's not all exhaustive, of the Medicaid services that we provide. We have a very large system of care, and we provide an awful lot of services to a lot of consumers. Go to the next page. We just don't do any type of services. Our services are evidence-based practices, largely evidence-based practices. They all have a Fidelity to their model, and we are always able to monitor and evaluate the delivery of our services. So when our consumers want treatment, we're going to provide them the best of treatment. We're going to provide them with the state-of-the-art treatment. So those are just some of the examples of the evidence-based practices that we offer up. The next slide here is the person-centered planning process. It's very detailed, it's very in-depth. I give it to you. You can go back and read it sometime if you wish. And it takes quite a while to get through a person-centered plan. A consumer just doesn't come in like to their physician, say, hey, here's what's going on, go take your aspirin and go home. You know, it's very detailed and very precise what we do in the way of person-centered planning. That's driven by the state of Michigan. This is a telling slide here. The Community Mental Health Services Program, the CMHSP I spoke about that we operate, we have 346 employees, and we have 110 professional contractors that work directly under and deliver the services through Community Mental Health Services. We contract out with 115 vendors, so like St. John Health System, we contract with St. John. When you look at the specialty services providers, we contract with St. John Macomb, St. John Oakland, Ross, St. John Providence. So those are the providers. And then we also have numerous collaborative relationships. You can just imagine, I threw a couple of them down here, Macomb Intermediate School District, Department of Human Services. So that's our service line. This is our workforce. This is where all the Medicaid revenue goes. So 456, thereabouts, people are working for community mental health. 346 of them are county employees. The other 3,500 people are delivering services through those contracts to the consumers in Macomb County. So the workforce is right around 4,000 people with the Medicaid revenue that we have. Like any other insurance agent, as you can say we are, a PIHP, we have all the responsibilities for providing a substantial network, like anybody else would to be able to procure that network, monitor that network, engage that network, do quality assurance, reporting, Medicaid billing. All of the requirements that are delivered by the federal government are passed down to us, and we make sure that we practice all of those responsibilities, utilization management of services, clean claims payment and processing. The next slide is all of our governmental state responsibilities. I'm not going to go through those. We do promote recovery. Even though I say consumers have long-term serious mental illness, people can recover from their mental illness. They may always continue to hear voices, they may always continue to be depressed, but that doesn't mean they can't be functional in our society. Same with consumers with substance abuse issues. They can recover, they may relapse, that doesn't make them a bad person. They'll get treatment and then they can recover again. So we really promote much of our livelihood in the system of care and recovery. Get into the finance piece. 90% of our money is brought in by Medicaid, okay? So the federal entitlements, the federal dollars come in through the Medicaid. There's a breakdown of what our revenue sources are. The county is mandated to provide me with a drawdown, a local drawdown on my general fund dollars that I get from the state, and a match on my Medicaid dollars. And so the county's revenue that you put forth there is right around that little green sliver, 1.7% of the budget. The rest of the monies are Medicaid dollars. But your match and your drawdown is required according to law. This is our expenditures. Most of the services go to community-based services. They go to residential care, acute psychiatric, inpatient, outpatient. My administrative costs are under about 6% right now. Feel pretty good about that. It's up. We've been historically around 5%. we're up to 6%. Here's my problem. Last April through October, Community Mental Health received a $3.3 million reduction in revenue. October 1st through March 31, we are receiving a $13.3 million reduction in Medicaid. And on April 1st, we'll receive another $12.7 million, 12.67 in Medicaid reduction. So I'm looking at a $29 million, almost a $30 million Medicaid reduction to the dollars that are coming to Macomb County. And that should be of concern to all of you, because it's the capacity to be able to service your consumers. Your consumers aren't going to go away. The medical necessity isn't going to go away. Just your dollars are going to go away. And your constituents are going to call you when there's a vacancy or a void in what the service delivery may offer up. So I'm out through my own collective efforts administratively trying to correct for utilization practices, hiring practices, staffing practices, expending practices. I'm also working with the legislature. I'm having legislative breakfasts, brunches. I'm going to invite you soon to that, so you can have an update on where you also can be instrumental in trying to preserve the dollars here in Macomb County. Because I'm going to tell you what's going to happen in a few minutes if you don't. And it's not a threat. It's just merely what it is. Working with the Michigan Association of Community Mental Health Boards in an advocacy plan. I'm working with my provider network in an advocacy plan. I really want to preserve the monies here, and I want to be able to preserve the livelihood of the prepaid inpatient health plan. If we don't preserve it, somebody else is going to be here, and I'll explain that in just a second. The next page, I'm about ready to wrap up, Madam Chair. The next page is actually my executive brief. I'm not going to go through there, other than if you look through that third column, if you can see it, the third column, about 2/3 of the way down, there's a $19 million deficit. Aside from the 29, I've made up 10 million. There's a $19 million deficit that I have to make up between now and the 1st of October. I don't know how I'm going to get there. I'm not going to get there, I'll tell you that. I need to be fully funded. I need to have a $12 million equity. As a school district would have a fund equity, I have to have an internal services fund because I'm in a shared risk management contract with the state of Michigan. If I don't have that $12 million, the state doesn't necessarily need to contract with me as the PIHP, the managed care company. What they may do, and the potential risk there is they take that $180 million, which flows through your county purse right now, and they send it down to Wayne County. Wayne County becomes the PIHP administrator for Macomb because we received the cuts, and then Wayne County will turn around, hypothetical, will turn around and give you maybe back $30 million out of that $180 million to direct operated community mental health services programs. And so that's my situation I'm in. I left a letter in the tail end of this that I sent to Senator Bita. It's just an example of the many writings that I've had over the last quite a few years. This is an issue that's been maturing for years. It used to be called Medicaid rebase. If you heard me speak here before, it was Medicaid rebase. Then it became rate setting, and now it's called Medicaid redistribution. Be more than happy to sit with you, tell you again what's going on relative to that. Medicaid redistribution, the affluent counties on the west side of the state and the northern Michigan are wanting more money than what they have and what they have had over the years. So it's a Medicaid redistribution, and it's affecting Macomb County far and away more than anybody else. I would ask that the Board of Commissioners work with myself, with the Community Mental Health Board, to the extent you receive and file, to the extent that you can work with me, write a resolution, participate in some of our legislative breakfasts, reach out to the legislators that you know. If you want to preserve community mental health services and you want to continue to make sure that we have that very solid system of care for our vulnerable citizens in Macomb County, then I'm going to ask that you help me out here. Thank you.
Thank you. Are there any questions? Commissioner Drollet.
Thank you, Madam Chair. Just, I'm sure you mentioned, or it's in the paperwork here, but that $30 million or 29 point whatever million dollars that has been reduced or that's missing, you've made up 12 million of that. What % of the overall budget does that represent, of your budget?
Well, my proposed budget for this year is about $160 million.
Okay, so this would fall short of that based on these cuts by about.
Well, it's the difference between the 187 that I was receiving and the 157 that I'm going to get. I don't know the actual percentage of the reduction.
Okay, thank you very much.
Okay, thank you. Commissioner Leonetti.
Hi, I question a little bit if you could clarify the 12 million equity fund that you call it. If I was to understand you, is that necessary to have in order for us to remain independent like we are now? Is that what you're saying you need as a reserve in order to remain an independent funded county like we are?
As a prepaid inpatient health plan in a shared risk management contract, I take my revenues and I take 7.5%, which next year will be $12 million, and I set that aside. Because,
I'm sorry, if we didn't have that, if you didn't have that 12 million reserve, then we would lose our status as an independent. And the example you gave where Wayne County would get the money, and is that what you're saying would happen if we don't have that 12 million reserve?
yeah, I'm worried about that. If we don't have that 12 million reserved, that's what it takes to go into a shared risk management contract with the state. If I don't have that $12 million up front on October 1st, they're gonna look for another partner.
Okay, thank you.
Thank you, Commissioner. Chair Smith.
Thank you, Madam Chair. Thanks for coming, John.
Sure.
I have a question for you regarding Macomb County. Are we the only ones that are getting, reduced like this? Why, if that is the case, why is it? Why is Wayne County not getting the same treatment? And is it just, their legislators are more on it in their, in Wayne County? I mean, they've been humping this a little harder. Or how, what happens? Like, how does this happen, if you know?
That's a great question. I know you've asked it before. In Macomb County, we're going to be affected far and away beyond anybody else. And then Oakland County is also being negatively affected as well relative to their rates. The essence of what has been happening, and has happened over the course of time, is when we delivered a particular service line. It's called community living supports. You look in the budget there, there's around $40 million where we deliver community living supports. We go into someone's home, we guide, we assist, we direct, we offer service and assistance, no personal care, to hundreds of consumers that are intellectually, developmentally disabled. We provide community living supports to those who want to live independently and alone, and they need to be free from health and safety. And as the example I often use is, if there's a fire breaks out, or if they have diarrhea in the middle of the night, I think they should have some common decency available to be able to have someone care for them. We've offered a pretty rich benefit. We believe it's within the Medicaid requirement, and we also believe it's closer to where the federal government is moving the federal regulations here in the upcoming, what do they call, a home and community-based services waiver. But the state feels that we've been a little too rich in the delivery of our services. And so in the funding formula, not to make this too complicated, but in the funding formula, they used to use a utilization factor. And for the last 15 years, prior utilization is a predictor of future utilization. They cut the utilization factor off. So to me, that has the biggest effect, because I've been utilizing and providing, consumers for services, these related services, and now because of the change in the utilization factor. So in essence, we've provided more services to more consumers over a longer period of time than most of the other community mental health services programs, and they're going to correct for it. I think they're going to correct for it way too quick.
Got it. This is obviously deeper than probably most of us can understand at this point. I know that, you went through it quick, and
Yeah.
we asked you to kind of go through it quick. I know Commissioner Duje from Health and Human Services probably be getting with you to maybe have you come back again and,
Sure.
and speak to us in a little more depth, and I'm sure that we would be happy to help, whether it be trying to get all of our legislators together for some kind of a breakfast at one time, so maybe you could kind of explain this to them a little better than we might be able to, probably a lot better than we might be able to. So, I'm sure Commissioner Duje will be contacting you soon, and we'll offer you any help that we can
Okay.
to at least get the message out
Sure.
to them.
Thanks.
Thanks.
Thank you. It's good. Everybody's effort will be helpful, sure.
Thank you. Commissioner Toko.
Thank you, Madam Chair. John, you went over what the cuts are for this year. Can you go over what the cuts are next year? So if we survive it this year, what are we looking at next year? And can you discuss how the cuts were implemented this year as a fraction, and then how they'll be implemented next year?
At this point in time, it's guesswork. We don't know what our structure will be like next year. It's largely predicated on encounter reporting. Every 2 years, the state does an actuarial analysis. They go through an actuary, a rate setting. They send those rates to the federal government, to Centers for Medicaid and Medicare Services, who certify those rates. The quick answer would be if we're looking at 157 million this year, I would think that right around $160 million next year will be our go point. I'm not aware of any added cuts other than, that your consumers are continue to be here, and we've received such considerable cut over the course of time. I stood here a couple years ago and our budget was $220 million. Now it's at 157. And so I'm going to say about $160 million will be our start for next year.
So what does that mean for CMH next year? I mean,
You have to have my entire focus is to have that internal services fund. So when the state issues their contract, the oddity is they issue your contract, you know this, Kathy, they issue their contract, and then they'll tell you your rates, later on. Well, that's no way to contract with anybody. That's the way they do it. And so, what we're gonna have to do is we're going to have that internal services fund. I have to have that $12 million to engage the state and say, we've been a great player for 45 years as a community mental health services program. For the past 14 years as a prepaid inpatient health plan, we are a good player. Continue to, contract with us. But they don't have to. They don't have to if I don't have the internal services fund strategy available.
thank you.
Thank you, Commissioner Toko. Commissioner Brown.
Thank you, Madam Chairwoman. The letter that you sent to Senator Beta, is that a form letter that was sent to the delegation, or is that specifically addressed to him?
An example of a copy that I sent out to the delegation, to the Macomb House and Senate.
Do you have any venues where you're planning to meet with them en masse on the subject?
With the legislator?
Yes.
I'm working with Henry Yanez right now, and he's meeting with the entire Macomb Senate and House delegate tonight. Said he would talk to me tomorrow morning, tentatively looking at a legislative brunch, perhaps 10 o'clock on February 13 or 17. Tentative, and you'll get an invitation.
Thank you. Keep up the good work. Thank you.
Thank you. Commissioner Duche.
Thank you, Madam Chair. I've worked with John over the last couple of years, and my agenda is always open for what has been going through at the community mental health. This program has gotten chopped, I want to say viciously, in the last few years, and after everything's said and done, Macomb County has had some tremendous growth in the last 5 to 10 years, and this is a function of growth in the county, whether you like it or not. I think that John has done a very, very good job, and there's a number of programs that have been cut that we know of that I'm not going to talk about at this point in time. But I don't think we can cut that much more. And I think that it behooves each and every one of us to work with people that we know, whether it's at the legislature or wherever, in order to survive and keep what we've got, and if anything, explain to these folks that these programs are needed in Macomb County, and we have to try to save this stuff. Other than that, you'll see John at the Health and Human Services Committee meetings probably more often than you want, but I think it's very, very important that this board be aware 100% of what's going on in the future and what's awaiting the citizens of Macomb County. Thank you, Madam Chair.
Thank you. Any other commissioners? Okay, I just want to say, outside of the Metro Detroit area, there's a partisan slant on this issue because of who is represented in rural areas. There is not inside of the Metro Detroit area. I've talked to colleagues from Wayne, Oakland, and Macomb, and people on all sides of the aisle are concerned about this. And it brings, for my position on MAC, it brings an interesting debate between commissioners in outlying areas and Metro Detroit areas. But this is a coordinated attempt to shift money into outlying areas, and I think our position is we have a lot bigger population, and so we're actually servicing a lot more. But there is there's no partisan issue in our area with respect to this. So I just wanted to point that out. Any other commissioners? Okay, this is just a motion to receive and file. Please cast your vote.
Thank you. Hope you all have a good year.
Okay, the motion passes 13-0.